Hi, I'm Patsy Smullen, president of KOBI TV NBC5. It's my honor to welcome you to Rogue Community Health's 17th annual event, this year a virtual celebration. 2020 has been a difficult year with the global pandemic, local fires, and the systemic racism that still continues in this nation. These crises have affected all of us, but have been particularly hard on vulnerable populations, which is why we are here to support Rogue Community Health and the community health workers who not only help people gain access to health services, but also what we call the social determinants of health: food, social support, education, and shelter. Which brings us to our first story about a man who needed a home.
Well, one evening just before I got off work, I got a call to go over to the behavioral health and speak with a gentleman, and he was in crisis. I'm feeling my emotion come up. He came in very distraught and confused, teared up, concerned about his mother. He'd been houseless for a few years, so he had been living on the streets and struggling, just trying to find, food, shelter. It had been a while. He'd gone in and out of the hospitals many times, the emergency room, and somehow just kept falling through the cracks.
Morg connected the man with various resources, including the Addiction Recovery Center. She walked him there to introduce him, and soon after, he stopped drinking entirely and continued to go there nearly every day for months. He also continued coming back to Morg.
This gentleman, ended up being diagnosed with dementia. He was incontinent. He wasn't able to take his medication on his own. And so, there were many things that were obstacles. And so when you have an individual like that trying to stay, for instance, in a shelter, it creates problems for everybody else, right?
Morg persisted, calling herself the squeaky wheel, as she continuously worked with various organizations toward finding a housing solution for him.
I can't tell you how many of my fellow co-workers, community health workers, etc., helped out, whether it was bringing a hot cup of tea, because this was, during the first few months of the year, it was freezing outside. And he would literally be there just purple. I mean, I can't tell you how many nights, I double-checked that he had a sleeping bag when he's laying on the cement. And yet he was always gracious. He didn't care how uncomfortable he was. Just the fact that somebody was caring, I think, really is what it was that kept him going.
After lots of perseverance, teamwork, and time, the team managed to get the man into an assisted living facility in Grants Pass.
I knew from back in the early March where he had been sent, which was, such a victory. And, there were so many people that were like, yes, right, it was amazing. Then I wanted to get permission from him if I could and find out, plus I wanted to know, where is he now? And I found out that he's on the coast, and he's, where I'm going to tear up. He's in a, sorry. He's in a memory care center. He's on the coast. He's getting his 3 meals a day. He's safe. He said to me, I said, you getting your medication? He goes, yeah, every morning. I said, do you get to go to the beach? Do they ever take you? He said, yeah, I just was there the other day. He is walking outside every day. He sounded so happy and strong. And he said, I'm really happy. I really like it here. And, of course, he wants us to come visit him. But he sounded so good. And if you could have seen his situation, the thought that this guy was walking the streets for so long, and and now he's totally being cared for. But it took a village to get him to where he is. First we have to open our hearts. We have to be willing to look at that other individual as somebody who is worthwhile and has value. Look at their humanity first, Start from there, right? Then start looking at, well, what's the solution? You know, what do they need right now in this moment?
If you would like to support the work of community health workers like Morag, please text Give RCH to 44321 or visit roguecommunityhealth.org/give. You will receive a confirmation email with the details of your donation. Thank you to everyone who has donated so far to help lift up those who need it most. We'd also like to recognize all of our sponsors for their generous contributions that not only help put on this event, but also will go toward funding the future good work of RCH community health workers. Thank you for your support. And now we're excited to announce the first of 3 live drawings to thank everyone for being here today. You can see here the list of prizes generously donated by local businesses. If you registered for this event, your name has already been entered to win. You must be present and watching to win. So if we announce your name, send a quick text with your first and last name to the number on your screen, and you will have claimed your prize.
Hi, I'm Celeste. I'm a community health worker at Rogue Community Health. These drawings are our way of saying thank you for being with us here today. The winner of our first drawing for FGen is Elizabeth Shea. Please go ahead and remember you must be present to win, so text your first and last name to 541-326-8189 to claim your prize. The winner of the second drawing, a grill donated by Lowe's Home Improvement, is John Forsyth. Congratulations to our winners, and now a special message from our presenting sponsor, JB Steel.
Hello everyone, I'm Russ Botzer, one of the owners of JB Steel, and I hope this message finds you safe and well. JB Steel is proud to be your presenting sponsor of the Rogue Community Health Virtual Celebration. Our family, or as I like to say, our family of families, has been in the Rogue Valley since the early 1940s, and our corporation started first with Botzer Construction in 1955, followed by JB Steel in 1970, and we've completed thousands of projects in the local market. Some of the more notable community projects that you might recognize would be the Mount Ashland Ski Lodge, Logos Public Charter School, Kids Unlimited, and the U.S. Cellular Sports Park. One of the more interesting projects in my career would be in helping the filmmakers for The Return of the Jedi, where we were helping these poor defenseless Ewoks get through the Redwood Forest. Anyway, on a more somber note, with the recent fires and the COVID-19 crisis, it's definitely increased the need for assistance with many of our people in our community. As a community, we can accomplish so much more together, but there's always more. JB Steel's mission is alignment. It is our goal to see things from all angles, to chart the course ahead and move together as one. We build better structures, ideas, and relationships when we see eye to eye to each other. With our customers, we start understanding their vision, then shed the light on opportunities to bring it to life, building possibilities into realities. That's why I believe our mission of alignment aligns well with Rogue Community Health that provides affordable, whole-person healthcare based on a team approach. We are truly pleased to support your organization. Have a great virtual celebration, and thank you for your time.
Thank you, JB Steel, and all of our sponsors for your support. I'm John Meitinger, Rogue Community Health Board Treasurer, and we are all so thankful for every one of you watching. Whether you have donated or are here simply to learn about what this organization does in your community. Our next story features CHW Celeste and the work she has done to help Rogue Community Health patient Joanne.
So I connected with our member Joanne by receiving a community health worker referral by one of our doctors. the doctor have mentioned that Joanne needed some assistance getting some extra food resources.
She's just been awesome. She's the one that faithfully brings me every single Wednesday, brings me a food box. And I wouldn't be able to make it, with food if it wasn't for her. Sometimes it's really pretty skimpy.
We'll sit down in the living room sometimes and just kind of go over how her day's going and if she needs anything else. A lot of what we do is connecting people with resources, and we'll either help them directly or point resources out to them so they can reach out to these other local companies that can assist them with whatever they need.
When I first started with my community worker, oh my gosh, she was like a sister to me. And she would go on the internet and try to, because I had no furniture when I moved into my house over at Brookside. And she would go on the computer and try to find freebies from me. And we were really excited. One by one, I got a couch and these tables and chairs. And pretty soon I had, all the necessary things for my apartment. So it was like Christmas when that kind of thing came around. My microwave in my in my kitchen came as a freebie. So I'm blessed.
We try to get to know them and get personal with them so they feel more comfortable to talk to us. And then once we establish that, then we'll ask. They feel a little bit more open to talk about what they truly need. And a lot of the times, they think they need very little, but then after the conversation, it's this giant list of things that could be also addressed to better their lifestyle too.
Joanne also receives care from Rogue Community Health's Integrative Health Center, where she is able to use integrative medicine to manage her diabetes.
They have put me on supplements, and I have been able to come off of almost all of my diabetic medicines, and it's really a miracle, because I really fought using medications at all, because when it comes to drugs, I really don't want to do that. But and they have put me on a special diet there, and it's really changed. My blood sugar went from 800 and it's down to 140 right now. So that was a big major change just with the diet and the supplements. Just the fact that when you get in a panic situation, when you get older, I'm almost 72 years old, and I never dreamed I'd be in this position. I was a caregiver for seniors for 25 years, and I was always the one that was doing for everybody else, and I always made the difference in their life. I would really try to say that they really do make the difference in our life.
I am proud of the work that I do. Yeah, I love it. I love helping people.
Without Celeste and community health, I would literally be on the street. I would be homeless. Yeah.
As you can see, our community health workers connect on a deep level, enabling patients to share what they really need. To support those connections, please remember to text GIVE-RCH to 44321. Even $5 will make a difference. And now, I'd like to introduce Rogue Community Health CEO, William North, who will share our annual report.
Hello, my name is William North. I'm the CEO of Rogue Community Health, and that's my great good fortune. I want to provide an annual update to you now, but before we do, I want to spend just a few moments talking about COVID-19 and the wildfires, and really acknowledging all that our community has been through, all that people who have been impacted directly by the fires have been through, as we give our update today, and support them as well in their time of need today. We do have some updates with some numbers. We're looking at how we engage with the community, and really this idea of systemic equity, which has come out of the racial injustice that has risen out of the pandemic and our recent months, and then focus on 21 and 2022 for us. COVID-19 has really been a significant impact for us. In March, we had to close down our dental clinic for emergent care. Mental health services have really been challenged. We moved our medical clinics to telephone visits and then virtual visits very quickly. And I'm so proud of my staff and all of the efforts that we went through to really make that happen. Telehealth and virtual visits are now bringing back our visits to where they were pre-COVID. We have strong physical presence as well. And right now, we're really looking at mitigating and minimizing the risks to patients and to our staff. After COVID-19, the full staffing for us has really been maintained. We've been able to maintain that because of many of the programs that we put in place to shift staff from one area to another. And as we did that, we really were concerned about what was going to happen with people as we isolate, the mental health problems that might occur as a result of that. And so we've been really working with our staff to develop good systems to support them. We brought in Dr. Frierson and his practice. They joined us in June. And we've been focusing on preventive care and quality metrics since then, but they are sliding. It is a challenge to provide those services in a virtual environment. But our focus remains on patient health outcomes. The wildfires this fall in September really impacted all of us. We were fortunate that they did not directly impact any of our clinic sites, although Butte Falls was impacted. Our staff were impacted, many were evacuated, but we have a wonderful staff who are very resilient, and though it's been a long 8 months, they continue to support the patients every day, day in and day out. Our heart goes out to the people in Talent in Phoenix, and we also want to give a shout out to La Clinica, our fellow FQHC in the Valley, for their resilience and the strength that they bring to the patients they serve as well. After the fires, we were out at the Expo Center in White City providing emergency services in Eagle Point and Ashland, and we've begun COVID-19 testing and flu season at multiple locations recently. We've been upgrading our virtual visits to really a permanent platform. We think this is the way we're going to be providing services in the future. And with systemic equity, we can focus on permanent solutions for people who have typically been marginalized by the systems that are in place. The Rogue Hub continues to be a strong part of our activities, and we're working with the CCOs and the Community Information Exchange on that. Let me give you a few numbers. We have unduplicated patients that have increased over this last year from 12,000 to just over 13,000 this year. Even with the pandemic, even with shutting down our clinics, we've seen a rise in the number of uninsured as well as OHP patients who need our care. Our member growth has increased as well with some of Dr. Frierson's patients coming on, but also with more people needing services due to the pandemic and to the increase due to the fires. Medical visits are down from where they were last year. We're seeing about 2,100 less visits that we're anticipating for this year compared to last year. But in the fall and over the last few months, we've seen those numbers come back to pre-COVID numbers. Prescriptions, we filled about the same number of prescriptions in 2020 as we did all of last year. So people still need their prescriptions, and we've been able to shift our services to support them even during this time with mailed prescriptions, with curbside pickup, and really a lot of the activities out at the Expo Center and in our emergency services. Other clinical visits, such as dental care, have not fared so well. We've seen a significant decrease in dental visits as we were shut down for several months. Behavioral health, we're doing well with that, except for the kids, the younger ones who have a difficult time with health care in terms of a video screen. And so in terms of other visits, we're down from where we were last year. I want to remind you around social determinants of health that lifestyle and environment tend to have a disproportionate impact on people's health. And that's why we focus on the ingredients that really support health outcomes. We focus on primary and secondary activities related to health, such as access to services or safety or food and housing. Then we focus on the economic and community impacts related to that, such as living wage or skills or mentorship, and really equity and systemic equity for all people as really being a key piece of what we want to do. And finally, we focus on self-efficacy and the support for people in making their own decisions. The Rogue Hub has really come out of that approach, and we look at generosity as really being the key to community engagement. So our shift from working with patients to focusing on emergencies this year has really been due to our ability to work with partners based on relationships that we've had for many years. Virtual support for COVID-19 and after the fires now continues, and we're looking at a community-governed, a community-operated activity and network as really being supportive of people after the emergency is over. Working with the CCOs and the Community Information Exchange is a big part of that. The Rogue Hub programs really do have a direct impact on patients. So a community benefit is identified, and for us it's really the investment and the return on that investment for community partners to be able to provide more services to patients. We are able to activate patients with the care that we provide, improve the quality that is provided to them. This creates patient and provider satisfaction, and as a result we get better health outcomes. In a sense, it creates the sustainable program that we're really trying to develop. So it's a virtuous circle, community benefit, patient activation, quality care, through provider satisfaction and into a sustainable program. And that's the key here for us. So your support is really the bottom line. For us, your funds really support the care we provide to get the results we want to get with the patients we serve. Those results turn into more support from the community. We use those to expand programs, and as a result, we're able to expand services to patients. So together as a community, we can support families, and together as service partners, we can support the families who support us. Racial injustice has really been a significant problem in our community and across the country. Community health centers came out of the war on poverty in the 60s, and a few years ago in 2017, the board reaffirmed that with a statement on trauma-informed care. And that's how the Rogue Hub and the Rogue Challenge came about. We also, just in May of this year, the board approved a systemic equity statement. So let's celebrate resilience. Let's celebrate the fact that we are focusing on finally putting this injustice away. Equity is what happens when resilience overcomes trauma. Over the next 3 years, we're going to be focusing on culture, capacity, and organizational learning. Our 3-year strategic objective is really to continue developing systems to support people in their need, social, economic, clinical systems, so that we can get to systemic and sustainable community health change for our community. So what's next for us right now? Well, let's beat COVID today and tomorrow, however that comes about. Support our communities in rebuilding efforts. Do that rebuilding with a deeper integration with our community partners. Increase our communication between organizations, between patients, and within the community, and improve systems for members. Better health outcomes and quality in a virtual world is where we're headed, and we intend to support that as best we possibly can. So thank you for all your support. It is very much appreciated and very much heartfelt.
Thank you, William, for that great update on the organization. Now we have another couple of drawings to say thank you for being here today. Remember, if your name is announced, text your full name to 541-326-8189 to claim your prize. We have another $50 gift card to Scape Tanning and Salon, and the winner is, let's see, Beverly Brooks. Text your name to 541-326-8189. Alrighty, so now we have another drawing. The winner for this drawing will be Ember Condra. This one is to claim the prize for a Book State Hop and Scape Tanning Salon. Thank you for them for the generous donation, and for Rogue Community Health to be here to support us as well.
Hi, everyone. I'm Kate Gillooly, Rogue Community Health Board President, and I have the honor today of introducing our keynote speaker. Artair Rogers is the California Program Director for Health Leads, an innovation hub that runs local and national initiatives to address the deep societal roots of inequity that impact health. Artair's work has been featured in the Journal of General Internal Medicine, Stanford's Social Innovation Review, the New England Journal of Medicine Catalyst, and Medical Care. He has a master's degree in health system administration, and he is working to merge health equity with healthcare delivery. We are so excited he is here to share with us today on steps and tools toward racial health equity. Welcome, Artair.
First, I would like to extend a sincere thank you and extend great appreciation to Rogue Health for having me today. Secondly, I hope that I'm able to keep everyone's attention as we anxiously await the incoming results of the presidential election, but I'm not going to make any guarantees around that. Often, when I'm asked to speak about racial equity, I have a tendency to try to disassociate myself and my identity from this topic. I've been trained to believe that neutrality and objectivity is the best approach to persuade others to be an advocate or accomplice to advance equitable and anti-racist practices. Well, I'm here to let you know that I will not be doing that today. I am a Black man from Mississippi who lives in California, who's had a parent attend segregated schools, and I can trace my family history back to slavery. So I want to give a disclaimer. I'm not at all neutral in what I have to say today. I've personally seen how racial inequity has negatively impacted me and generations before me. And with the state of our country today, neutrality and being passive further advances inequity and disparities. Well, fortunately, and unfortunately, we do not have to rest upon personal testimonies like mine to promote the value case for racial equity. We, for decades now, have data that clearly illuminates the need to address racial health inequity, and this data is even more significant with the global pandemic we are experiencing today. This pandemic has shown us that our collective health actually affects our individual health. But this has always been the case. The disparities we see in healthcare affects us all. Despite having the most expensive healthcare system, a Commonwealth Fund report shows that the United States ranks last overall compared with 6 other industrialized countries: Australia, Canada, Germany, the Netherlands, New Zealand, and the United Kingdom. And this is on measures of quality, efficiency, access to care, equity, and the ability to allow its citizens to lead a long, healthy, and productive life. Now, as we take a closer look at the coronavirus, the Kaiser Family Foundation has noted that even as of August, the COVID-19 related death rate among Black people was over twice as high as the rate for white people. The indigenous population had a mortality rate nearly 2 times that of white people. And data also revealed rises in mortality rates for the Native Hawaiian and Pacific Islander individuals and the Hispanic population. Now, many of you may have heard this data before today, but I challenge us not to look at data in a silo fashion. When we start thinking about inequity, particularly in equitable systems, it is important for us to look at inequity's compounding effects. I am going to be showing you a slide that was done by Health Leads. Give me 1 second. So at Health Leads, we had to start crosswalking the COVID-19 data with the new demand for essential resource needs. The illustration you see here was created by Health Leads and depicts the total demand for social services as compared to social service capacity over time throughout the COVID-19 crisis. When you look at the curve, you can see the demand for social services far exceeds the social service capacity. And this is happening as the demand for access to social essential resources is at a high critical level, but connection to those resources is harder because of the changing landscape of our social safety net because of shelter in place restrictions and the complexities of having to wear masks. But at baseline, the US has large racial disparities, not just across health outcomes, but also with food insecurity, income, and access to adequate housing. At the peak of the first wave, we experienced unemployment that rivaled numbers of the Depression. The devastating job losses have affected all groups of Americans, but Black, Hispanic, and other workers of color have seen steep declines. In June, ProPublica showed that the unemployment rate for white people was 9%, yet it was 15% for both the Black and Hispanic populations. The RAND group goes even further to show that by August, the white unemployment rate was 7.3%, but for Black workers, it was 13%. Now, we may wonder what the long-term effects are, but RAND did research that showed that the Depression showed that the disparity in financial strain took more than 10 years for Black workers' income levels to return to that of the pre-recession level. Therefore, we must rebuild with a racial equity lens. Otherwise, the aftermath of COVID-19 will continue to disproportionately impact Black, Brown, and Indigenous communities. To make matters even worse, these communities are also experiencing the crippling effects of multiple crises simultaneously. So I just mentioned the economic crisis, but we also have the social racial unrest. We also see in states like yours and mine, the effects of wildfires. In Phoenix, Oregon, nearly 1,000 housing units were destroyed by the wildfire. Many of those in mobile home and RV parks, disproportionately impacting the Latinx community. With all I have said, I hope that we're understanding that equity is not a nice to have for our work, it is now a requirement. Now, as I talk about the need to focus on equity in your work, you may be asking, how do we do this? I want to talk about some clear pathways to promote racial health equity. So the first thing is pretty simple, but yet pretty tough. We have to do some self-reflection and self-realization to recognize that we have created harm. We have all operated in systems that do not center equity, which results in the perpetuation of disparities and inequities. Even more than operating these systems, sometimes we've created these systems and we need to own it. We have to apologize to the community for doing that and work with the community to fix it. So again, I'm going to share my screen. And I'm going to go through this framework. Most of us participate or have participated in, or maybe have even created savior design systems. This simply means that we create interventions, systems, and programs for the most affected or the most historically disadvantaged and underinvested communities. We don't involve the members of these affected communities in our work, but we expect them to adopt and accept the interventions that we propose. If they don't, particularly in the healthcare system, we label these patients as non-compliant or difficult. And the sentiment is conveyed that, hey, affected population, we know what you need more than you do. Now, some of us do a little bit better and look to partner with the community. But what does this partnership look like? Are you only seeking feedback or consulting patients regarding a new case management program or getting feedback on their clinical experience? Does your patient advisory council represent or even overrepresent individuals who are experiencing the most hardship? If the partnership is only focused on the priorities of the health system, or the partnership does not involve truly working with those experiencing the starkest disparities, at best, you're doing allied design system work. The community has no true decision-making power, and the needs of the most marginalized are not centered, which ultimately means you're not addressing the root causes of the disparity. And that's where equity-empowered systems comes into play. It requires shared language, shared communication, and shared power. And your work has to dig deeper and center on the root causes of disparities like systemic racism. So how do you create equity-empowered systems? Operationalizing equity requires intention. Who do you have at the table? How are you designing processes that facilitate equitable practices and equitable results? What is your health equity intention with the work you produce? So I've stressed the importance of having people of color, especially the most affected populations, at the table. Now let's look a little further at the how. You have to invest in processes that are community oriented. Bring in those voices into the room before you start designing a program. Create opportunities to share power by allowing the community to have decision rights in your work. Also, as you partner with community-based organizations, invest and partner with community-based organizations that are led and or target people of color in their work. We have to uplift and sometimes help do capacity building for organizations that typically don't get the same type of funding or same type of attention that major institutions receive. Lastly, we have to think about what is done with the products that we create. So I'm going to talk a little bit about data. Data is an expensive commodity these days. And what we see for people of color is data is continuously extracted from them without any regards to investment in them. So I have to ask you, is the data pulled and analyzed from the health system, is it validated by the community? Are your community health improvement plans validated by the community? Are they influencing, and when I say they, is the community influencing what you determine as a health priority? When you conduct process improvement projects or projects aimed to improve the patient experience, how are you including community voice? As you hear community voice, are you overrepresenting the perspectives of the patient population that's most affected by the disparity you're trying to address? And can the data that you're collected be used as an advocacy tool for your most affected populations? And I bring up data a lot because data narratives that you create, especially as a health system, about your community, these narratives can harm or help the community. You have a way of presenting information about a community that can be viewed in a deficit way or in a resilient manner. And so are you being careful with how you're stewarding that information? So when it comes to the data that you all collect and use and analyze, I want you to anchor on these 2 points. First, data about the community not approved by the community is invalid. And secondly, are you stewarding the data you collect and analyze in a way to advocate for the needs of the historically underserved, underrepresented, and underinvested? Lastly, we have to go beyond addressing symptoms and risk. We must also address root causes. So I must ask you, is your work typically focused on addressing symptoms or risk, or are you looking to address the root causes? Exercises like the one I have displayed, the 5 why exercise, is designed to cause us to pause, to dig deeper. Even starting with a question with who's missing from the table, how might we more directly involve historically underrepresented and underinvested groups This 5 why exercise makes us ask continuously, why is the issue occurring multiple times so we can get down to the root. And once you get to the root cause, then you can start asking what action should be taken? What role should the community have? See, we tend to value going fast, but equity work requires us to pause sometimes. It's needed because much of the systemic inequities we see are rooted in policies and a troubled history that goes beyond decades beyond us. And it's a lot to weed through. Therefore, we must elevate the workforces that are uniquely positioned to do this type of work. That's why I'm really excited that today's event highlights the importance of community health workers. Community health workers come from the community and have an ability to build a trust with patients that's hard to replicate in the healthcare system. Their cultural sensitivity and often trauma-informed approaches positions CHWs with the ability to glean and hear the root causes and barriers that prevent individuals from obtaining an optimal health status. But just having community health workers is not enough. They have to be respected and valued. We have to determine processes that allow their vital qualitative data to be integrated into the care plans and give them opportunity to do some of this root cause analysis work. So if you're serious about the racial health equity journey, community health workers are instrumental to this work, as they will be essential in helping your health system uncover root causes or barriers regarding individual health and the root causes of disparities within your community health status. So those are just a few ways and a few pathways that I implore you to explore in your racial health equity journey. I have to be honest, it's an extremely challenging time to talk about justice, racial equity, systemic oppression, and racism. I remember being taught about systemic racism and hearing the Malcolm X quote used to describe it, that this is not a chip on my shoulder, that's your foot on my neck. And after seeing the news of the murder of George Floyd, where we actually saw a knee on someone's neck, Black people, and often people of color, are put in the position to repeatedly describe what it means to experience systemic racism and give recommendations on how to address it to our white colleagues. My ask of you today is to not let my sharing and other people's sharing with you be in vain. I ask that you not be passive in doing this equity work, and do not simply be well-intentioned in your efforts to elevate racial equity in your work. Be explicit. Acknowledge and apologize for harm. Ask communities of color to interrogate your actions. Take opportunities as an institution to share power with the community, especially those who are from the most historically underrepresented and underinvested groups within your local geography, and seek to address root causes. I leave you with these words from Archbishop Desmond Tutu. If you're neutral in the situations of injustice, you have chosen the side of the oppressor. So today I just ask you, please don't be neutral. Thank you and take care, everyone.
Thank you, Artair. We're so thankful you could join us and share such important information and insights. We'd like to again thank event sponsors who have made this event possible, and also Rogue Community Health's all-volunteer board of directors, who so generously give their time and energy year-round to crafting the vision and guiding policies for the organization. And thank you to all of you who have donated, because without your help, Rogue Community Health couldn't do what they do. And now we have one final story for you today of a single mom with 3 children who needed access to resources but feared reaching out due to her legal status. Rogue Community Health is here for everyone, and this is her story.
pues yo soy una mamá con 3 hijos. Mi hija la mayor tiene 23 años, la del medio tiene 17 y tengo un niño de 5 años y una nieta que es parte de mi vida también.
I've been working for Road Community Health for about 8 years, almost a year as a CHW too, and I love the work that I'm doing, helping the members in the community.
El primer recurso que obtuve de ustedes fue el apoyo moral, que me dieron la confianza desde el primer momento que hablé con esta señora Isabel. Me sentí con la confianza de expresarle mis sentimientos, mis problemas, mis situaciones y pues sí, eso fue lo primerito y algo de mucho valor.
Sometimes people don't know the resources that are in our community, and so we're here for them, and we want our patients to know that we're here to support them either emotionally, socially, even if it's just to complete an application, finding a job. They can use us community health workers for a week, a month, whatever the situation is. We are here to help.
Son muchos servicios, mucho apoyo, especialmente con los alimentos para toda mi familia. Me han abastecido como no tienen idea. Hubo momentos en que decía yo, no voy a completar esta semana o este mes. Yo no tenía un carro para moverme. Yo no podía, hubo otros lugares donde me orientaban, donde podía ir a agarrar cajas de alimentos, pero yo no tenía un carro para moverme. Yo tengo mis hijos pequeños conmigo, yo siempre al pendiente de ellos y sin carro yo no podía moverme. Entonces, platicando con esta señora Isabel, ella se ofreció a traerme mis alimentos hasta la puerta de mi casa y es algo que no hay palabras para describirlo.
So I deliver the food boxes weekly, either on Tuesdays or Wednesdays, depending on her schedule. I try to accommodate to her schedule. And so it feels good to be able to help and deliver those food boxes because she doesn't have the transportation for that. So that feels good to be able to help.
Son varias necesidades que me han ayudado a salir adelante. Por ejemplo, en tiempos de que hacía demasiado calor, mi casa no cuenta con un aire acondicionado y ella me buscó un aire donde nos sirvió de mucho. Aparte de eso, mis hijos me pedían una alberca, donde hubo el momento que decía yo, esta vez no puedo, este mes no se los puedo comprar, y eran los meses que se necesitaba. Y yo le comenté a Isabel, y yo no sé ella cómo le hizo, pero ella les hizo llegar a mis hijos su dicha alberca. Los juguetes para mis hijos. Se llegó el mes pasado que fue cumpleaños de ellos. Yo me siento tan afortunada de verlos felices con unas piñatas que le trajo. A mis niños, ellos no saben si su mamá puede complacerles sus deseos o sus gustos, pero Isabel me ha dado la confianza de yo comentarle o pedirle la ayuda, donde ella me ha hecho posible y realidad ver la felicidad de mis pequeños.
many times they don't know that we do have Gabriela as our attorney at Road Community Health. So we kind of explain the services that Road Community Health offers to our members. And so once they feel like that connection, they start opening up and they ask for more services. But we let them know that we do have this service and that they don't have to fear due to their legal status, so they feel confident.
Para mí la señora Gabriela ha sido una persona con un enorme corazón. Al igual que Isabel, he sentido la total confianza de platicarle mis situaciones, donde ella, con mucho gusto, lo que ha estado en su alcance, me ha apoyado. Que no tenemos que callar, tenemos que hablar, buscar la forma de encontrar personas como ellas, como Gabriela, como Isabel, que a veces pienso que yo no merezco tantos servicios que yo he recibido por parte de ellas. Yo me siento una mujer de verdad. Perdón. No tengo palabras, pero les agradezco mucho todo su apoyo, sobre todo a usted. No puedo. Es todo, gracias y Dios las bendiga, les deseo lo mejor.
If you would like to support this work, you can still text GIVE RCH to 44321. We have one more drawing before our event concludes, and I just want to say thank you for taking the time to be with us today. We are thankful to our board for inviting many of you and for the work they do year-round. We are thankful to our sponsors, who are the reason we could make this event happen. And we are so thankful to each and every one of you who found it in your hearts to donate. All of these contributions will ensure community health workers can continue to make a positive difference in people's lives. If you would like to continue to follow Rogue Community Health's work in the community, please follow us at roguecommunityhealth.org or on Facebook and Instagram. Thank you, and have a wonderful rest of your day.
It's time to wrap up our event today with the final drawing for a one-night stay in a deluxe jacuzzi room donated by Green Springs Inn and Cabin. The winner for this awesome prize is Donald Blaser. Be sure to text 541-326-8189 with your full name to claim your prize. We are so incredibly thankful to everyone who watched and those who donated today. Today, between all of your contributions and our sponsors, we were able to raise an amazing amount of support from everybody. That amount will be an amazing support to Rogue Community Health and our community health workers as they continue to help the Rogue Valley most vulnerable population. Have a great rest of your day, everyone.